All right. Well, hello everyone. My name is Phoebe Carlson, and I am the Community Service Director for Arlington Young Dems. I'm here with Dr. Eric Feigl-Ding, who is a CNN commentator and an epidemiologist with 2 degrees from Harvard, one in nutrition. And he's here to speak with us today and answer a few questions about the coronavirus. Do you have anything else that you would like to say about your background, Eric?
No, happy. It's too long and complicated, but been thinking about pandemics for a long time.
Well, we are happy to have people like you who were paying attention before we all were paying attention. Um, Anyway, so let's get right into it. Why don't you start off by telling us why this pandemic is not just another flu? Let's start there.
Yeah, I think what people really need to realize is that this epidemic is not like anything people have seen before, and I would say that people have a trouble realizing imagining what they've never seen before. And to have told someone back in January that we would be in the greatest financial crisis of our century, the greatest epidemic that has shut down entire countries for weeks and months at a time, and basically you'll be all out of school. 16 million people have filed for unemployment in just 3 weeks. It would just be, I might as well have told people that aliens are going to arrive next week.
Right.
It would be on that same kind of, it would be on the same kind of order of magnitude of crazy. But here we are. And in the flu, there's a lot of people who said it's just a flu. And what they don't realize is this epidemic this virus is very different. It is potentially 2 or 3 times more infectious, as in the reproductive number, the R naught, for example, is about 3.8. And 3.8 means for every person infected, they infect 3.8 additional people. Contrast that with the flu. The flu has a reproductive number of only 1.3, so not even 1.5. And so this is way more infectious. And over 10 cycles, you're talking about exponentially way more people. Many of us have some background immunity to the flu. For this virus, we do not. Flu, we have a working vaccine that works half the time, most of the time, 3/4 of the time. For this virus, we do not have any vaccine, and we won't have one for another year at least. In flu, we have treatments like Tamiflu. For this one, there are no proven treatments yet. As much as Trump wants to wish that there is a magical cure right now, so altogether, it's pretty worrisome.
It's a whole nother beast. And back to what you were saying about background immunity. So is that something that you would say that there are some people who are saying, well, I never get the flu shot, I never get sick with the flu. So your response would be, well, we have that background immunity, so even if you don't get the shot, you still may not get sick.
Yeah, so with the flu, all of us have come down with the flu at some time in our life. The flu mutates, by the way, much faster, which allows us to need a new shot every year. But we all have partial immunity to the old flu shots out there, to the flu out there. And again, the flu shots do work. And again, there's also herd immunity, that if enough people are immunized, herd immunity is basically, say there's a crowded room, you have the virus on the other side of the room, I'm on this side of the room. If everyone in the middle has immunity, then the virus can't hop skip across the room to me. But if no one has, or very few people have immunity, then the virus can hop skip eventually to me still pretty easily. And so, but right now no one has that. And you don't want to go through herd immunity, preferably, because that involves potentially a lot of people getting sick. Unless this virus has a large asymptomatic population, which is possible. We can get into that. But yeah, it's much worse than the flu, and it spreads asymptomatically. Like, there are some people who just don't have the symptoms or don't have the symptoms yet, but they can still keep spreading it. And this is why it's so important to stay home, because you think you're perfectly healthy, but you could already be infecting others. And that's why this is a very pernicious, intransitable property of this virus. And this intractable property basically is why this virus is the one that is conquering the world.
Right. So when we're talking about, again, differences, is there much of a difference between the incubation period of this one? I'm not sure what the incubation period of the flu usually is.
Yeah, the flu varies. The main incubation problem I want to highlight with this virus is that it's on average about 5 to 7 days, but the problem is that there is a huge distribution, and people are going to quarantine isolation for 14 days, right? But the problem with that is that there's a lot of people who actually have incubation longer than 14 days, and during which time they can keep spreading it.
So, longer than 14 days.
Yes, there's about anywhere from 1% to 12% of patients who, if they have virus, have a longer incubation than 14 days. So it is something that even our quarantine currently can't fully capture, and I've been kind of raising this issue, but people are ignoring it at the current moment, because it's so difficult, even as it is, to quarantine people for 14 days, especially healthcare workers.
Yes, I know that too well. Yeah, so the death rates of this virus too among younger Americans seem to be kind of misleading us. Whereas we started saying, oh, if you're older, you really need to be concerned, but if you're younger, you're okay. So now we're battling that misinformation that was spread, that you're not in danger if you're young. And now we're hearing, that a significant percentage of these hospitalizations, perhaps not the deaths, but the hospitalizations are people under 40. What would you say to convince those young people that they aren't immune just because they're young?
Yeah, I want to first point out there's more hospitalized people under age 65 right now than over 65 nationwide. And young people actually do, even among those 20 to 40, do still have a very high hospitalization rate. Obviously lower, but there are so many young people who still get hospitalized, still go to ICU and intubated. And although the mortality is much, much lower, it is still a severe disease for so many people. Again, on average, 1 in 5 people will potentially need to be hospitalized, which is a very, very high number. Obviously, ICU is much lower of potentially under 10%, under 5%, but you're talking about, in terms of burden on our healthcare system, whether they're old or young, they take up a hospital bed. That is one hospital bed fewer, one ER room fewer than what could have saved someone with a heart attack or stroke. or got in a car accident, needs emergency surgery. Every single bed basically displaces one of those people who need care. Like New York City right now has a 911 ambulance response time of anywhere from 1 to 2 hour waiting time. And if you have a heart attack, or if you're bleeding to death, or you have some sort of major emergency, 1 to 2 hours in New York City means potentially you may not make it, right, if you have an emergency.
Right, absolutely. Yeah. And then I have heard from other doctors as well, emergency room doctors, saying that it's really shocking their number of, say, like appendicitis patients that they had, 2 months ago versus what they have now. And so there's a concern that people who may need to come to the ER aren't, because they're afraid of, contracting the virus by coming to the hospital, right?
Exactly. Either they're afraid or there's just no space. It's just, or they just die at home. And right now in New York City, for example, on average, New York City has 25 home deaths per day in New York City before the epidemic. Currently, New York City has anywhere from 250 to 300 home deaths per day. That is a 10x. And not all of them are COVID related, but again, this is what I'm saying. A heart attack or stroke that could have been saved with a 2-hour ER waiting time. A lot of these people, I would say these are still COVID-related deaths, right? And that's what's so frustrating with this. And this is why flatten the curve not just benefits coronavirus patients, it benefits all of us. Because any surge and displacement of healthcare capacity really hurts us all. And so I cannot emphasize enough that, A, young people, you still get hospitalized. B, every hospitalization displaces a bed that could have been saving someone else. And C, you could be transmitting the virus asymptomatically to someone else who is vulnerable. And it's not just the elderly. It is people with heart disease, stroke. Obesity is actually a risk factor too. Lung disease, smokers, and kidney disease, and liver disease. If you think about the total number of people with any of these things, think of how many people with asthma and diabetes.
Hypertension, right, is one.
Yeah, hypertension is another one. Huge numbers of people have high blood pressure, and that's a major risk factor. Altogether, young people, you're not immune, and you're actually endangering others, not just your grandma.
Right, and I do want to say to that point too, like I said to you earlier, I am a healthcare worker. Sometimes leaving the hospital, I have to walk through the emergency room in a hospital in DC, and on any given normal Friday night, Saturday night, I walk through there are so many people are sitting on the floor, and this is, before coronavirus, so it's absolutely...
It is just completely taxing our healthcare system, and it's so frustrating. So, I think what we need to do now is just, at the same time, accept that we have to stay home, but we also have to find a way out, because we can't stay locked down forever. And I understand lots of people are frustrated, lots of people are unemployed, and the sad part is, the vaccine's not going to arrive until early 2021, maybe late 2020 if we're lucky. But the vaccine's not going to be mass available until much later. And so there's some epi modeling studies that show we might be in these closure in and out kind of situation for, until 2022 potentially.
I actually have a question about that.
Yeah. It is possible. So are in the most severe, trying times that we've ever faced in the past 100 years, or maybe since World War II.
So actually, to go off of what you were saying, do you think that there's a possibility that we would be able to reopen our economy and go back to our normal operations and gatherings after the summer, or do you think it's likely that we will have some measure of social distancing in place for the remainder of the year?
Yeah, we will have some sort of distancing and some capacity limits. Like if we reopen movie theaters, it might be half capacity or 1/3 capacity. If we have baseball, basketball games, it might be half capacity as well. Same with restaurants. Capacity limits will definitely change. Maybe workers may have to be tested weekly or every other day for this virus. There's a rumors of should we have immunity passports or immunity certificates that if you do antibody testing, which is testing that if you have immune resistance to the virus, because immune antibodies for that, maybe you could therefore safely navigate the world with immunity if you have this, if you show your papers, right? But which also creates a lot of social justice issues. We have enough problems with voter ID laws, and if we have to require these blood tests, medical release kind of things, papers, it would just be the most dystopian thing.
Right.
Then we are dystopian times. So
that we are.
It is possible, but I think a combination. I think we need to set, like for example, circuit breakers, where if we reopen, that if it immediately surges past a certain point, we have to reclose again, right?
Mm-hmm.
You have to have these circuit breakers. We can't just be a carte blanche, everything normal again, which again also may keep some people hesitant to go out to restaurants. It is a fact of life. We might have to do a lot of food delivery, a lot more Zoom and Skype calls.
Right.
And we will have a lull. I think in terms of different parts of the country, New York is slowly peaking, but again, New York deaths have surged again today. In Virginia, I think I was earlier reporting that Arlington has 400 cases, while Fairfax has 1,200 cases.
Do you think that speaks to Arlington doing better? And I have questions about your assessment of both Arlington and Virginia's response. Are we doing something right in comparison to Fairfax and Loudoun, or are we just lucky?
We're a smaller county than Fairfax, obviously. So in terms of rates, it's we have to calculate that.
Right.
I don't think it's hard to say. Because Virginia, it's not like Arlington has dramatically different rules than Fairfax. If anything, Arlington's much more dense, so we actually have much more closer packing in of people and whatnot. So I think Virginia is still relatively okay, but I could see that the epidemic can grow at any time. Because what oftentimes happens in epidemics is there's a one random super spreading event, which again, like a big convention, CPAC conference, or the Biogen conference up in Massachusetts, one event caused an explosion. And Louisiana, what happened in which they didn't close Mardi Gras was actually one of the worst mistakes.
And spring break in Florida, right?
Spring break in Florida, and they actually did analysis. A lot of all the cell phone chips, SIM cards that were on that beach in Fort Lauderdale, I think, or West Palm Beach, they tracked them a week later to all across the country. So these kind of events, and you have to think of the U.S. as a ship. Ships usually have bulkheads, but the thing is, we don't have borders. We don't truly have lockdown checkpoint borders between U.S. states, right? There is no such thing as borders between U.S. states. And so if there's 50 holes and you plug 40 of the holes, but 10 of the holes are still leaking and you can't turn off any bulkheads to stop the leak in one part of the ship to protect another part of the ship will still continue to go down, still continue to flood with water from the remaining 10 leaky holes. And the leaky holes being the states that don't have good lockdowns. Kansas. In which the Democrat governor put in the lockdown, the Republican legislature overruled her and vetoed her. And now Kansas don't have anything. So it is extremely, extremely frustrating. And again, Florida is also very kind of late.
But on the scale, Virginia, you would say Virginia is doing enough, or should we be doing more?
Virginia, I would say, gets a B. Virginia has a lot of, like some states have like legal enforcements with, we'll send you to jail, give you a ticket if we catch you. Virginia has half-page of rules, 1.5 pages of exemptions. Now, I judge at this current moment, but some of the exemptions are very lax. And obviously it's necessary to protect, the ill and the infirm. And but it's really hard to say. I think the other problem is that, again, you can be as strict as you want, but because we don't have any cross-state borders, checkpoints that can shut off the border between states, because think of how many small roads there are between every state.
Right.
It is so frustrating. We can do the best we want, but if West Virginia doesn't shut down, or if North Carolina doesn't have a lockdown, or they lift it at a later point because their governor is over aggressive, then we have a serious problem. And so this is why it's so important to contain as much as you can. And I think, for example, the Northeast states have a pact. There's a 7-state pact, just like California, Oregon, and Washington has a 3-state pact, that they will work together and they will shut down or close their states in unison. That way there's no like a whack-a-mole that this state opens but this state's closed, but then it just causes spillover, and it's just terrible, because that's what we want to avoid. And again, we need to ramp up testing, and not just testing, because right now, not just testing of patients in the hospital, because New York City is so swamped. They're only offering tests to healthcare workers and people who are admitted to the hospital. So if you come to the ER and you don't even have severe enough symptoms to be admitted and you're sent home, no test for you.
You're hearing a lot of people who had that happen to them and then later died.
Yes,
right?
Exactly. Yeah. Later died, and oftentimes later died without a test. So we're also potentially undercounting. New York City, by the way, they calculated. New York City has an excess of 5,000 cases in the past month. 5,000 cases in the past month between. What? Oh, I'm sorry. My son needs my phone. I apologize.
No worries.
Yeah, so the testing, we need kind of like frontier testing, as I say. As in, we need to test as soon as people become symptomatic, right? As soon as they're symptomatic, they need to get tested. And again, once you're tested, you need to get contact traced to find who you exposed to in the past week or two.
Yes, absolutely. And there seems to be a bit of a stigma to, people who have been diagnosed with COVID, but they aren't doing the contact tracing for those patients. If you want to tell your friends that you're waiting on a test because, here it's taking a week to get your test back, you can't even, like a lot of people don't feel like they can, text their friends and be like, just FYI, I'm sick, because, they get treated like a leper. So that kind of sucks. But at the same time,
yes.
it's necessary for us to be so careful. And, we're all doing this social distancing. And so, let's talk about on a personal front, we just talked about what the states are doing. But some Americans are social distancing except for seeing maybe another family who is also social distancing, going to the store once every 2 weeks, or they're going over to see their parents every once in a while. And then on the other side, some Americans are shaming their friends, who are breaking this quarantine, being like, what are you doing? How likely are these seemingly small deviations to hold back our collective efforts? Should we be stressing? How much should we be stressing over this?
I would say, first of all, if it's just point to point, you to your moms or you to grandmas, which again, grandmas is a little higher risk. It's less contained. It's more contained. But if you visit a friend and a friend visits someone else, and everyone just visits one other person, this could eventually still domino out. And so obviously keep it really close and make sure they keep it close as well. Remember that in the old STD advertising days, is like, for everyone you sleep with, you're sleeping with everyone else that they're sleeping with. It's kind of like that. At some point you have to. Everyone has to be on a really good honesty system but I think that is less of an issue because I think that kind of exposure is much limited than compared to, say, going to a restaurant. I think the biggest issue is grocery stores. Because everyone says to go to grocery stores or the pharmacy, and the grocery stores, you know that you walk within several feet of them. And by the way, there's a new study that says 6 feet distance is not enough. You may actually have to go to 4 meters, which is like 12.
How many feet is that?
That is
12 feet.
Yeah, well, 1 meter is 3. Right?
Are there any other? Yeah, no, I think you're right. It's like 3.33. But Are there any other diseases that need to be that far? This one can spread by aerosolized particles, which a lot of other ones don't, right? Is that the sole reason for the 12 feet?
No, they did a study that of a patient who's sick, and they measured how far away from that patient will they not find virus particles anymore, and the number was 4 meters, which is more than 12 feet.
That's so shocking.
It is quite shocking, and again, it was a published study. So this is why, back to grocery stores, masks are important. Everyone wear a mask. Masks are actually quite effective in terms of, even a cloth mask is really effective in stopping the sprayage of your saliva, because you spray saliva in droplets not just when you sneeze or cough, but when you talk loudly or talk at all. Like when I'm talking into the computer right now, I'm spraying saliva into my computer screen.
It's a beautiful picture.
Yeah. So that the mask actually covers it up, and if everyone covers it up, then the exposure is much, much more limited. So this is why masks are very important.
On the flip side, does a cloth mask really do anything for you, or is it really just protecting other people from you?
It's really for protecting other people. To protect yourself, surgical masks, by the way, are leaky. They do protect if you can create a perfect seal. Like there's some people who say put like a really tight rubber band around your surgical mask, and it can give you much better protection. Obviously, N95s, we should save them for healthcare workers. But there's alternatives, KN95s. KN95s are almost as good as N95s and much more common. So oftentimes, 3M is producing N95s, but the KN95s, you can buy them from China, and they're readily available for like $2 each. And again, you're not really depriving healthcare workers, because KN95s are very, very prevalent. You can buy them in bulk. But I don't think you really need them for the most part, unless you're, again, treating patients or going somewhere where you know that there is potential high virus. So I think for the most part, cloth masks to protect others. And again, this is like vaccination and herd immunity. If everyone vaccinates, actually protects the elderly and the infants who aren't vaccinated necessarily, right? But it's an honor system, and it only works if everyone does it. So with cloth masks, everyone's protected if everyone wears it. Everyone protects each other if everyone wears it themselves, right? So I think there's and American culture is not a mask-wearing culture. It's seen as rude, seen as sometimes criminal, because I think the Daily Show made a point like, it's easy to tell people to wear masks until you tell a black person to wear a mask. And then, because an African American knows that when they wear a mask, there could be much more problems with the law because of some other, racial profiling to happen.
Absolutely. Oh, it's so tough.
Yeah, so it's easy to say, and so this is why it's, again, if it becomes a social norm that everyone does it, then it's much more acceptable. So
I do have another question about the spread. So I read a study that they found that patients were shedding the virus in fecal matter as well. I don't know, are there other viruses that also are respiratory viruses but also shed in fecal matter? Like, we should be emphasizing hand washing, because if it can spread through fecal matter, your mask isn't going to help you.
Yeah. So yes, definitely hand washing. If it wasn't obvious now, please hand wash religiously. Maybe stop washing. Stop shaking hands. Definitely wash hands. So the fecal matter is kind of funny. There's another study with the old SARS, which their coronaviruses, in terms of infectiousness to your body, they're different, but in terms of general virus particle properties, they're similar. There's actually a study that says flatulence up to several meters is also infectious. Now, this is from an older study, and I am an epidemiologist, just sharing public health facts with the world.
Dead.
But there's a study that shows flatulence of the old virus, SARS-1 virus 1.0, was potentially infectious up to a several distance. So take the precautionary principle, Now, I don't know. I don't think we should all be wearing diapers per se, but this is why social distancing matters.
A little extra.
I am trying to entertain and provide information.
I mean, I think you are meeting your goal. I do have another question that I personally have. So in the operating room, I've heard a bunch of people who work with nurses, we're hearing that there are so many people that think that they either had COVID-19 before its specific emergence in Seattle, or that they were seeing chest x-rays of patients in December where they didn't really understand what was going on. Do you think it's possible that the virus was here before we realized it, or is that just kind of people kind of imagining things?
I would say it's possible in December. I don't think before December. I don't think before mid-December, because some of the earliest cases in China were discovered in mid-December, around December 10th or 11th. There's obviously a lot of travel between Wuhan, which is a major multi-million person city in China, and other parts of the world. So it's possible, around Christmas, right? They came here, but for the only identified case so far, the earliest is mid-January, and by genomic epidemiology, we know that there's community transmission ever since that time. Mm-hmm. For example, we can pinpoint. Remember that Grand Princess, not the Diamond Princess of Japan, Grand Princess cruise ship off of San Francisco. Mm-hmm. That was actually infected from the Washington cluster. Infected that ship off of San Francisco, which sailed to Hawaii and then sailed to Mexico and back to Hawaii and back. And we know that came from the Washington cluster because we can analyze. It wasn't from Los Angeles, China to Los Angeles, or Europe to Los Angeles kind of transmission, because we can analyze the genomic epidemic. So the earliest we found is that January Washington cluster.
Right.
Can there be an earlier one? Yes, but we haven't found it yet. We haven't sequenced every single person's virus yet. And right now, for example, New York, all the evidence, the vast majority of New York cases came from Europe.
That's interesting.
Not from China directly. So
right, and then there's a lot of people who are, tracking this and getting, annoyed with China for their, response. They're trying to place a blame on somewhere, like you brought this here. So that is very interesting that that New York cluster came from Europe. But as far as those people are saying, do you think that China responded quickly enough? Do you think they should be closing down their wet markets to stop any more possible spillover events? Like,
Yeah.
what do you think about how they handled this? And do they deserve blame? Is this something that they couldn't foresee, or should they have done more?
Yeah, I think China definitely has some blame early on. They reacted very slowly. They tried to silence the early doctor who tried to whistleblow about this. I'm not a fan of the Chinese government or how they reacted, but whenever they did, they definitely, brought down the hammer and with the very strict quarantine. The issue is, everyone probably accepts at this point that there's undercount. How deaths there are in the U.S. That is almost inconceivable that U.S. has 612,000 cases and 25,000 deaths, and 2,000 died just yesterday alone. And for China, with the billions of people it had and extreme measures that went into Wuhan to only have 3,000, it's almost it's very unlikely. And we know that there's underdiagnosis even in the U.S. right now. For example, New York, for example, has an excess of 5,000 deaths in the past month compared to a baseline rate. And of the 5,000, only 3,000 are coronavirus positive deaths. There's an additional 2,000 excess deaths that have not been attributed to coronavirus per se. Either they're unidentified causes, which we haven't tested for, or they're heart attacks, which again they're COVID related. I say it because they're hospital capacity related.
Right. So you're taking with a grain of salt all of these news stories about the U.S. Becoming the front runner in cases. You're kind of like, well, it could have still been China.
In terms of front runner, how do you define front runner? Total number of cases, or in terms of cases per capita? In terms of cases per capita, U.S. has not been the leader yet. I could see it definitely being the leader in the near future someday. But per capita, Spain has it much worse. But if you break
that's important to explain too, because that's a very sensational headline, a very scary headline, and I'm reading these things as we all are, and I haven't seen something say per capita. I didn't even think about that, so that is an important takeaway from that.
If you broke New York out as its own country, though, okay, New York would definitely win per capita.
Yeah.
So if New York was its own country, New York would be by far the largest country epidemic. But obviously, U.S. is a very uneven distribution of cases. There's some in California, some basically along the coastal areas in New York, Boston, but in the interior parts of the country, it still hasn't caught on yet. And again, in Texas, in Florida, there's a lot of undertesting. And we think that undertesting is probably at least 10x, potentially even more. And in terms of asymptomatic, CDC says there's about 25% of all cases are asymptomatic. Iceland, which has by far done 10x more testing than in the most countries, Iceland says it's about 50%. And just yesterday, there's a new study among pregnant women admitted to hospitals in New York. And what makes this unique is that there's universal screening. All pregnant women who go deliver a baby in New York City are screened for coronavirus. And so because of this universal screening of all pregnant women who come to the hospital to deliver, they found that of all the cases, all the COVID positive cases among the women, only 12% of the women knew about it, that they had any symptoms. 88% of the women had no symptoms at all. 88% of the positive women had no symptoms, which is enormous if you think about it. And even after they delivered, it was still well over 80% of the women who still never developed any symptoms, even though they were coronavirus positive. That just shows you that that's an enormous amount of asymptomatic. which
When
is
you
crazy.
say asymptomatic, do you mean that they have not developed symptoms yet, or are these people who will never develop symptoms? They just
Both.
had the virus and passed it and never knew.
Both. Because if you just take a cross section, you can't tell. They're mixed in, right? For example, I said upon admission of the hospital, 88% of the positive women have no symptoms. Upon discharge from the hospital, still 80% of the women did not. So there were like a couple percentage who did develop symptoms by the time of their discharge from the hospital after birth delivery, right?
Yeah.
So we call them pre-symptomatic, the women who eventually will, and then there's the never symptomatic, never symptomatic, asymptomatic, and we can't really tell for sure because we didn't follow the women long enough, but it is 80, whether it's 80 or 80%, it is a darn large number. But that said, pregnant women are more immunocompromised than regular people, so it's possible that that number is a little bit higher than normal. So it's hard to say. That said, whether it's 25, 50, or 80%, that is because if you all the businesses and say anyone who doesn't have symptoms can come back to work, that is still a lot of people carrying the virus. And reminding the old story of Typhoid Mary, which was a woman in the 1900 period in New York City. She was a cook, and she went house to house to cook for wealthy families. And she had no symptoms, but she was silently carrying typhoid, and she sickened all these different families wherever she went because she was a family cook. And eventually, they nicknamed her Typhoid Mary.
My mother, who is actually watching, hi Mom, I actually know about Typhoid Mary from when I was a kid because that was like her fun fact story that she used to tell us.
Not so fun fact.
No, but like
Typhoid Mary. After they discovered Typhoid Mary was carrying it, they locked her up the rest of her life.
Oh, okay, that's not so fun, Mom.
Yeah, that's so fun. But it highlights the danger of an asymptomatic carrier of this virus, right? Because reopen and you don't have testing. This is why we need testing. And not just testing people who arrive at the hospital. Testing upon first symptoms. And again, for the asymptomatic, blanket testing for certain workers who are, grocery store workers, healthcare workers, firefighters, police officers who have to go out into the field every day. They need testing, and unless we have testing, we won't.
We're not going to stop it.
Yeah, because all this slowdown, lockdowns, they're called mitigation. It's like dropping a water from an air tanker onto a wildfire. You won't ever put out the wildfire. You'll slow the wildfire, but you need boots on the ground to actually dig trenches and dig a perimeter. And that's why we need to testing, contact tracing, quarantine to build that perimeter in order to fully contain this epidemic.
Yeah, right. And those are important measures. Well, I've run through all of my questions, so I figured we could take a few from the audience. I've got 5 that I would love to get to in the next 15 minutes if we can try to do that. So our first one is from Mike Heminger. He is wondering if you could provide your thoughts on what you think the ramifications will be from the president's recent decision to cancel funding for the WHO.
Yeah. My analogy was, do you cancel FEMA funding in the middle of an earthquake? Do you cancel the National Weather Service in the middle of a hurricane? And so canceling WHO in the middle of infectious disease pandemic is the most nearsighted thing that I can possibly imagine.
But unfortunately, something that we have come to expect from our president.
Because look, the other thing is, pandemic is by definition pandemic. It is everywhere. It is. You go here, the risk, the epidemic can come to your country very easily from other countries, and wherever you travel. And so, wouldn't it be great if we helped the world stopped their epidemic, because let's just say we fully stopped our epidemic, there will always be people coming in and out of our country. It is very narrow-sighted to say we're not going to help the rest of the world. It's not like the pandemic, the infectious disease is by definition global. So cutting out WHO funding, really stupid. He says he will withhold until a investigation. So it could just be, him.
Kind of goes back to that nationalistic close your borders thinking that, we're not all interconnected like we are in this whole age of planes, trains, and...
Because even U.S. citizens will, because you can never close your border to a U.S. citizen. No. U.S. citizens has every right to re-enter their home country. You can't close the border. And U.S. citizens will eventually travel abroad, and they will come back and potentially bring virus, and that's a fact of life, even if you try to stop all foreigners. And you can't. And so, cutting off WHO funding is ludicrous, because the WHO does things that other countries don't appreciate, and they go places where you can't send people to. For example, the jungles of Africa to hunt down Ebola. Mm-hmm. Ebola is a sub-Saharan Africa thing.
But something that was necessary to track down because of that 2014 outbreak. That could have become global if they hadn't done it properly, right?
Exactly. And that's why in 2014, I led the first team to build the first mobile app for contact tracing, digital contact tracing. But the problem was, you try to tell people, we need this. It's like, oh, for what? If, a really bad plague, an infectious disease like Ebola arrives, like, what's the chance that Ebola will come to New York City or San Francisco?
What was the chance of a wet market virus coming to New York City when we sure found out?
So WHO funding cut off. Very stupid. Next.
Great. Next question. This is from Tura Arsala. He would like to know what advice you have for folks who have long-standing health issues and who are afraid for the future.
This is very tricky. There are a lot of people who are immunocompromised or have cardiovascular risk factors, diabetes, lung disease, kidney, liver. I don't have a good answer other than that it is still very dangerous for them. Eventually, we'll see if antibody testing, and I think hopefully when we have drugs, because short of a vaccine, there will be hopefully drug treatments that will be proven to be successful later this summer. Maybe early summer. We'll get more drug trials finishing in May and June, and more in July and August. And some of the drugs will be readily available because they're already on the market. And if we have these drugs ready that can treat patients who are hospitalized or in ICU, that would be really great.
Give them more of a chance of survival.
Because right now, if you are sick, we have no real countermeasures. We're basically giving you oxygen on a ventilator or an ECMO machine, which is extracorporeal membrane oxygenation, which is like a kidney dialysis for giving you oxygen equivalent. It's very invasive.
It's not cute.
We don't have real treatment. That's the problem. No. And, we can talk about hydroxychloroquine until the cows come home, but, we've had 2 studies actually not work out. We actually had a trial on hydroxychloroquine terminate early because of adverse events.
Yes.
And it's very dangerous. And
I guess your advice would just be to really follow the instructions that you're being, given, right? Making sure that you are really social distancing, because it is unfortunately a scary time for people who have those pre-existing conditions.
I think those risk factors, people have to be really, really careful, and hopefully we will have countermeasures for them, but not yet. So we must be super.
For now, Peapod and delivery, Tora. And so our next question is from Sam. As we pass peak cases, how do we begin to restart the economy? It seems like mass testing and case management is not feasible in the near future in the U.S. So what does that look like for you? How do we start to restart the economy?
Yeah. What I was going to suggest is, we have to, restart it when the cases are low enough.
Mm.
We can't do it like right now it's increasing. It will eventually plateau, but we shouldn't do it. Plateau means there's an equal number of new cases a day, right? We should do it when the actual cases are dropping. And again, we also have to have like circuit breakers that if it starts rising again, we have to put the lockdown back down again. We have to have capacity measures on all these public places. I don't think we should have like crowded indoor events at all. Again, maybe we're trying to improve the serology antibody tests. Maybe we could have immunity tests. Because those tests are cheaper than the nucleic acid ones. Because the direct test right now, you have to stick this really long needle up your nose,
It's not fun.
to the back of your throat. It's really big. But the other serology ones, if they perfect it, you can do a simple finger prick test.
Yeah, and they currently do those for healthcare workers who, like for hepatitis B, right? You have to have those serum, those titers done for antibodies to make sure that you are immune to hepatitis B. So it can't be that expensive if they're doing that for all the healthcare workers.
Yeah, they have to validate it, but it should be faster. You can do a blood draw test, but they're trying to create these kits. It has them, but they're not perfect yet. Hopefully, those kind of things will give you a little sense, and then some people can go back to work, and low risk factor people can go back to work, and again, low density people back to work.
Yeah.
But again, testing. You really need testing. I cannot emphasize enough. If actually, I'm gonna invoke the porn industry because they actually have really aggressive testing for STDs, and like the sexual transmitted diseases epidemiology in the porn industry is actually very aggressive, and so I'm not saying we should adopt all of them, but the principles of epidemiology that guides how they manage risk is valid. That testing, and someday we might have to have like maybe have shift work, like workers. There was like two cohorts of workers. Cohort A works week 1 of a month. Cohort B works week 2. Cohort A gets tested. If they're healthy, they come back and work week 3. Right? They rotate, and then they only rotate in people who are healthy. We may have to do a lot of these things.
Our government just has to bite the bullet and realize that it's going to cost them, that it is going to cost them a ton of money, but that we, need to do it. And going off of, we're talking about going back to work. Our next question is from Sam Carlson, another Sam. And so she says, as a hairstylist, I'm obviously not working right now. How do you see my field going back to work with us standing so close to the person who sits in my chair? Nail salons, bars, massage parlors. How do you see these service industries operating in the near future?
Yeah, that's very tricky. I think certain industries will be required to have N95 masks, or at least KN95 masks, which are also have the same amount of 95% filtration. And it's dystopian to think that these people have to wear the same masks as healthcare workers. But if they do, we're entering a phase in which people all starting to have bad hair, mine included. And so, eventually at some point, we're all going to look like, cavemen or cavewomen and raised by wolves. But we definitely need our hairstylists. But
there you go, Mama.
Well, we need to have enough masks, and right now there's not enough N95 masks even for healthcare workers.
No, there are not. We are currently reusing them constantly and sticking them in a Tupperware container.
Yeah, and then using UV light to disinfect them, hopefully, because UV light is the best way. Because if you
need to get a wand,
it is tricky. And right now, if we don't have enough healthcare worker N95 masks, we might not have enough for hairstylists and nail salons.
Everybody who needs them.
Yeah. So I think I think KN95 masks are almost as good. So they can't withstand as high of a pressure, but in terms of filtration for everyday breathing, they're almost as good. And they are readily available online. You can order them. You should be able to get them within a week or two from China or from wherever.
I was going to say, I don't know, you can get anything in a week or two at this point.
Yeah. I would go into good portals. Don't buy from a sketchy site. Get it from like Alibaba Express. They're like an eBay of China, and so if you get conned, you can claim money back and all that. And again, don't order N95 masks. Save them for healthcare workers. But the KN95 masks are almost as good. They're a good substitute. But
again, you don't need them unless you are really coming into contact with people, right?
We're talking about if we go back to work, right? And I think a lot of jobs, in addition to that, I think grocery store workers are so heroic, and they deserve these masks as well. So, and until the N95s shortage is caught up, I think the KN95s masks for all of these people, these essential employees, firefighters, police, grocery stores, and other key employees and businesses, they need them. We need to ramp up. We need to have a Manhattan Project for.
Yeah.
But unfortunately, we're in a function of our own negligent management of this epidemic. Yeah. And I'm going to say, because we did not place any bulk orders for PPE until mid-March. Until it really showed up under our nose, the federal government did not place one order of any of these. And this is why it's so frustrating that we are here. But here we are.
Going off of, our very last question is actually about masks. So this one's from Tenley O'Hara. She wants to know if we should be wearing masks everywhere, like if you're walking around your neighborhood. They were saying wear them as soon as you leave your house. And we see people on the streets who are wearing them just walking their dog. Like, is that necessary, or do you really just need to wear them in crowded spaces, like if you're going to a grocery store?
Yeah. So cloth masks, you should wear them everywhere because, obviously in an outdoor park, there's less risk of infection. But I've been to the parks, which, by the way, parks are in the Ralph Northam's waiver list. Okay.
Mm-hmm. I've been preaching about that. I'm upset about that.
but at the same time, if you go on the weekend, these parks are crowded. Like, technically there's a 6 feet rule, but the 6 feet rule apply if you're like breathing and then someone zips past you in a bike. I don't know. Does that count? It's so vague, and again, parks are getting crowded in many ways. So I think masks, especially cloth masks at the minimum, is a really good way to go. I think, as a general rule, because you also want to set social convention as well. So I think it's quite important to have them.
And even if even if they're not necessarily protecting you, like the N95, it is, protecting us as a society. We're going to be able to reopen our economy faster.
Yeah.
So we should be wanting this cloth mask.
Again, if we all do it, we're doing it to protect each other in case you have an asymptomatic carrier of it. We just have to assume that we're all typhoid Marys, and we're perfectly healthy, but we are potentially infecting others. So please wear your masks, cloth masks, when you're going out in public. So
that is a great sentiment to end on. Protect your neighbor, wear your cloth mask, and hopefully we're weathering this together. We'll make it through the end. So Thank you so much for joining us, answering all of mine and the audience's questions. And thank you for the work that you're doing. Thank you for paying attention. Thank you for, spreading this information. It's really important. So we appreciate your work.
Yeah. So everyone, thank you for being, abiding by this lockdown during these very, very trying times. I know people are oftentimes suffering immensely, and I hope everyone stays safe and think of others. Think of your family, but also think of others around you when you go out. So, God bless everyone.
Thank you.
Thank you.
All right. Bye-bye.